Hello, everybody. Welcome back into our Keep Boone Healthy Facebook channel. We hope that you and your family are having an enjoyable weekend, and we want to come with some new information for you and a new way of dissecting what we are looking at in terms of COVID spread in our communities, but also just some general information that we feel like can be helpful heading into the Thanksgiving holiday and the holiday season following that. So we've got a panel of experts, probably one of the smartest Zoom calls that I've ever been on right here. We've got Jennifer Greene. She is, of course, the Director of Public Health for AppHealthCare and a frequent guest here on the program. Also a frequent guest, Dr. Scott Elliott, Superintendent of Watauga County Schools, and new to the program, but not new to our community in any way, shape, or form, Dr. Scott St. Clair of Ridge Pediatric and Adolescent Medicine joining us. So again, thanks to all of you for not only joining us today, but for the guidance and service that you provided to our community during these trying times.
Great to be here.
Thank you, David.
Thanks, David.
So, Jennifer, we'll start with you in that since we talked to you on Monday as part of our Vision Northwest North Carolina series, there have been some new measures that have been adopted by the North Carolina Department of Health and Human Services and the state overall, really, to help communities track COVID-19 spread in a little different way. They're doing that now. There's also been some additional guidance come out from the CDC as it relates to quarantine and isolation periods and things of that nature. So I think it might be first best to start with what's changed since Monday that you can alert us to as we continue to track data in this very important way.
Yeah, sure. So I'll just say that I appreciate everyone tuning in and continuing to learn as we see the science evolving and our response evolving. The North Carolina Department of Health and Human Services announced a COVID-19 county alert report that's going to be published every month. And so the good news is that we are a yellow category, and there's really three warning areas on that report: yellow, orange, and red. This is not a contest that we want to win. So we are in yellow right now. And really what that tells us is that our numbers are pretty fragile. And it's important that we take every action that we can to try to avoid going up into the orange and red categories. What drives those categories are really how many cases we're getting and how fast we're getting new cases. So the rate of cases for our population size. There's also some other metrics like the percent positivity of tests that are happening in the community, as well as several hospital metrics, because we have to look at all pieces of the puzzle to know how we're doing as a community. So the good news is we're certainly not the worst on the list, but we need to pay attention because things can change pretty quickly. The other thing to say is with new guidance all the time, we are continuing to just clarify what we do for isolation and quarantine. So it's really important for the public to know one of the highest risks you can have is having a household member who's positive for COVID-19. It's just really hard to avoid exposing your other household members because the virus hides. You can be infectious before you have symptoms. And so what we know now is if you are positive, roughly for 10 days is what we are thinking, you're actually probably re-exposing the other people in your household despite all your best efforts. And so your quarantine actually cannot begin until the end of your last day that you're exposed to another person in your house that's positive. So it's guidance that we've been following, but I think it's been clarified. And look, it's just important that we do all we can to prevent being exposed and do our 3 W's that we've been talking about: wearing our mask, practicing distancing, washing our hands frequently. It's going to be very important because that can be a pretty major shift in your family routine if you have COVID hit your household.
Dr. St. Clair, I wonder if you can follow up on one element of what Jennifer was just talking about, and that is the new metrics within the county system. You know, a part of the hospital guidance that is now available, and part of that has to do not only with treating patients that are in the hospital with COVID-19. But this was the first time that we really saw the state spell out how critical staffing measures play a role in hospital effectiveness within communities. Can you speak a bit about the impact that this whole entire process has played on the medical community, and for those that are on the front lines like you and your staff, to not only have to deal with COVID-19, but all of the other variables that you deal with, and different procedures that you have to follow for those things throughout the course of a given day anyway?
Yeah, I think when you're seeing, particularly in some other places that are some of the worst in the country right now, one of the biggest issues is that their hospital capacity is maxing out, and a lot of the hospital capacity maxing out is staff maxing out. And so I think that was one of the reasons that the state, when they did their new alert system, added hospital capacity, ER capacity to sort of the alert, because at some point, part of how we're doing as a community is not just the cases, not just the positivity, but is our capacity as a healthcare system okay to absorb, many more cases. And so I think part of that is everything Jen just talked about, the washing of the hands, the distancing, and the mask. It's not only helping your family members, but it's helping your community members. And some of those community members are, essential healthcare personnel. So to the extent that we're doing all those things to help prevent community spread, we're also helping our ability to maintain our hospital capacity.
Let's talk a little bit about the Thanksgiving period that's coming up. And certainly this is a period of time that not only are our high country families used to traveling around, this is also one of those kind of gateway periods of time where we see more people traveling to this area as well, and having those extended choosing cut stays or ski stays or what have you. So with all of that said, Dr. St. Clair, I'll start with you. From, again, the guidance of a doctor to families that are looking to travel, what are some of those things that you are encouraging your patients to keep in mind, not only about the actual physical part of traveling, but what the risk is going to a new area and coming back to a new area, and the things they need to think about in that regard?
Yeah, I mean, I think the biggest thing to start with is just saying, I know this is really hard, and I know we're deep into this and everyone's getting really tired. And so I think part of it is the decision fatigue of all these decisions. I mean, I know with our family, we've in the last several days had to make travel changes to our plans, and we were hoping to get to see some family we hadn't seen, but we made the decision the last couple of days not to travel and just to stay home. So there's some sadness associated with that, but it really seemed like the most wise thing to do is for us to stay and just celebrate Thanksgiving, as a family. And so I think new CDC guidance coming out yesterday was to limit any travel that you would do. And I think just limiting who you're going to be celebrating with to really the people in your household who you're normally with. So I think that would sort of be the best advice. I think sort of beyond that is limiting the number of people who you're around. Outdoors is better than indoors. And I know we live in the mountains, but that still is true, to try to be outside when you're with people as much as you can, to stay distanced and to wear a mask. Anybody who's sort of outside your house and you're interacting with has just got the potential to introduce the virus into your house, but potentially for you to introduce that virus into their house. And so I think it's really important to be mindful of all this as we're heading into Thanksgiving holidays.
Dr. Elliott, I know that many people have heard your various forms of communication over the last several months, and talking about how community activity impacts activity and how schools are able to operate right now. I would imagine that you see Thanksgiving as an opportunity to have some break for your educators and get them ready for the stretch run of the year, but also as somewhat of a concern that people are going to be spread out a little bit more than they have been, and could potentially be bringing things back to school. How are you addressing that with parents and students at this point?
Yeah, and thank you, David, for having us back on. And I want to say thank you to Jen and AppHealthCare and Dr. St. Clair and Ridge Pediatrics, all of our local medical partners who've worked so closely with the schools to support us and advise us and to help us through our decision making of all this. Is great partnerships with these folks. I'm very pleased that we do have students in school right now, even on our modified 2x3 schedule. My hope has continued to be to get more students back into school. more days a week. We know all the ways, and we've discussed on your program before, the ways in which our children and our families are just struggling with children not being in school. That said, it has gotten increasingly difficult, and especially this week. It seems like this week has been the most critical week for us in terms of the number of cases that we've had. We've had this week 7 staff members and 17 students who've been COVID positive, mostly from outside of school activities. We're seeing almost no spread within the school population of students to students or students to staff. We are seeing some staff to staff spread, but really what's happening are those outside of school activities. And we've talked about them for a long time now, but as those activities increasingly come indoors, as Dr. St. Clair said, with the cold weather months, more people are together. It's just hard to try as parents to find that balance of normalcy and healthy activities for our children where they can still be with friends and going to church and playing athletics and things like that. But that's where we're seeing spread right now. Of course, we're concerned about what happens after Thanksgiving. We've heard in recent days a couple of school systems nearby to us that have decided to take next week off, the week of Thanksgiving, and kind of reevaluate things. We're going to continue to stay open, but it has been increasingly difficult to operate schools. So much in that same way that Dr. St. Clair mentioned that hospital capacity is more limited by the availability of staff and the ability to keep staff in those hospitals. That's our challenge with schools. It isn't that we're seeing spread within schools. It isn't that coming to school is unhealthy. It's keeping enough staff in the school to be able to operate, especially under these 10, 14, and 20-day quarantines. So as I've said before, if we want to keep our schools open, it's what we do outside of school that will determine our ability to continue to operate school, which is absolutely what we want to do.
Dr. St. Clair, in that same vein, that the creating the normalcy in a family setting, I know that a number of parents, I'm sure, have brought that concern to you about how they balance that activity, the travel sports, the things that we know to be part of our normal day-to-day routine. But at this time, you're trying to get that mental release for those young people, especially, but also trying to be safe and vigilant on the other side. Do you have any advice as to what that balance looks like?
Yeah, I think one thing I would just piggyback on what Dr. Elliott just said. I think we have seen in our office over the last 2 weeks an increase in cases for sure. And as we're tracking what's going on statewide, but we're trying to track all the cases coming through our practice. And the majority of the cases we're seeing through our practice is through known household contacts. And so we just really haven't seen a whole lot of school spread. It's been from that more close contact spread outside of school. So I would echo that. I think, with the activities, this has been a tough year for kids. It's been a tough year for families. And I'm just really trying to encourage people to find things they can do, but it also keeps them safe. And so I'm talking every day about people finding outdoor stuff they can do that's consistent. If they're gathering, doing it safely in small groups as opposed to big groups, and trying to find these activities that hopefully are outdoor nature, where you can stay spaced, where you can do some things with friends, but in a smaller group setting and outdoors. So it's hard. And I think it's getting harder as we're losing sunlight. It's getting harder as we're moving into colder time. But this is a time I think everybody just needs to continue to push through and try to find those things they can do that do keep kids healthy, but balance the safety concerns.
Well, and I think that we've seen evidence of our greenways being packed and our hiking trails being packed. And as the weather gets colder, people are just putting on sweatshirts and staying outside. So hopefully that is a good sign and something that we can see more of. Jennifer, I know we talked on Monday a bit as we were discussing the impact that employers see on employees and things that businesses can do to promote positive reinforcement of whether that's COVID procedures from a safety standpoint, or also just kind of reminding that businesses have some options available to them should they have employees that have to step out from the workplace due to a COVID diagnosis, and ways that they can continue to pay those folks and get reimbursed. I think one of the things that stood out to me as much Monday, though, was the mental health aspect of this, and employers making sure that they are helping their employees through, as both doctors have told us here, are difficult times for kids. That means they're difficult times for families. And sometimes we have to remember that we're all going through this together and have that opportunity to release a bit. What have you seen from a resource allocation standpoint, either through your work at AppHealthCare or things that the state is trying to push and make available that are helping people with the mental side of this right now?
Well, we definitely have seen more clients taking advantage of telehealth for behavioral health services. And that's a great technology that a lot of providers offer. And we've seen that really uptick. I would say too, there are some other resources at the state level, and we're here to help too. So if you have folks who might need help with groceries or getting things for them while they're in quarantine. We've been doing that for months, and we're happy to continue to offer that support for our community. And I would just say the biggest thing is acknowledging it. I think this is a heavy time, especially for employees who are trying to balance the upside down world that we're in for their families. If they have children, it's just a lot to process. And I think having a place where we can acknowledge it. I know we've had to do that with our public health staff, and also to just try to be resilient and explain that we will get to the end of this tunnel that seems like so long. We will get there, and so I think that's really a key, is acknowledging it and linking to other resources. There are resources out there for folks, regardless of their ability to pay or insurance status. A lot of providers are happy to assist if they have someone who is struggling. So I think talking with your healthcare provider is the first thing to do, but also know that we're here as a resource too.
Dr. Sinclair, I'll ask you this question, and Jen, maybe you can follow up. We have seen so much in the news about vaccine deployment here in the last several days, especially, and what that timeline looks like, not only for frontline healthcare workers, but then who gets next and next and next down the line. So with that said, I think there's some hope that's certainly out there that maybe we will indeed get to the end of this very long tunnel soon. But I think there's also a pretty steady message coming out from the healthcare community that does not mean drop your guard at this point in time. How have you tried to bottle up that kind of philosophy and message that to your patients?
Well, I do think that part of the mental health aspect of this is holding on to hope that at some point this is going to get better. And I do think that's important. I mean, I think particularly as we're talking with our parents and particularly our teenagers, it feels like life like this is going to be like this forever. And when it feels like it's going to be like this forever, you just give up, throw your mask away, and just, go do whatever you want to do. So I think giving people some hope, but I think hope that's based in some reality. And so I think 3 or 4 months from now, once we're past flu season, once the weather starts getting warmer, once hopefully at that point there might be some vaccines that are deployable out to the general public, I think things are going to be in a whole different space. So I think part of it is know the next few months are going to be challenging. Be creative. Do the best you can, work through the tough times. I think things are going to be better. So I would hold on to that piece of hope. I do think the news of the vaccines the last 2 weeks is legitimately good, scientifically good news. I do think both of these sound promising. They're probably going to get deployed probably end of the year, December into January, out to healthcare workers and some other higher risk groups first. And then I think hopefully as we get into spring, it sounds like that may be something that's available to the broader public as they figure out what's going to be the the distribution strategy, sort of tiered out risk kind of things.
Jen, you have anything you'd like to allow to that point as well?
Oh, I would just add, there is hope, and yet it is very important that we continue to do the prevention measures right now, because while we can feel hopeful that there is a vaccine right around the corner, we know that the initial deployment of those are exactly as Dr. St. Clair said. It's going to be to priority groups and healthcare workers initially. So really, we're not going to see broad distribution for a few months down the road. And I would say too, know that there is a plan. North Carolina actually has been working on a vaccine deployment plan. It is publicly available. And we have been working both with our partners and thinking internally about what our plan is going to look like to make sure that we get vaccines out to the public and make sure it's easy for folks.
And I know flu shots a big part of that too. Jen, can you elaborate a bit on what is available in the community in that regard? And have you heard that flu vaccines are being taken seriously at this point in time? Is that something that our community seems to be doing right now?
Well, I think it's one that I hope we are all taking seriously. I've been sort of preaching to our public health staff that if you are the person that's been holding out, this is your year to get started with a flu vaccine. There is probably no more important time than now. We don't want our healthcare system strained with flu and COVID at the same time, nor do we want our bodies to be strained with flu and COVID. So it's really important. And we know flu, unfortunately, claims a lot of lives every year. And for some reason, we've become desensitized to it. And there is a vaccine that makes a big difference. So local providers like Ridge Pediatric and Adolescent Medicine are providing flu vaccine. Our pharmacies have flu vaccine. AppHealthCare has flu vaccine. Your healthcare provider has flu vaccine. Please get your flu shot. It is very important this year.
I would just echo that and just say, please, 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 if you're listening and haven't gotten your flu vaccine, please get your flu vaccine. I mean, I think in general, that's always a good idea, but particularly this year with COVID, those symptoms are going to look exactly the same. So if you come down with the flu, you're going to think you've got COVID, and that's going to trigger an entire series of testing and quarantining and all this kind of other stuff. But what we also don't know is what happens when you get flu and COVID at the same time, or what happens when you get flu and COVID in back-to-back months. We truly don't know. And I think back to the hospital capacity, if all of a sudden Watauga Medical Center has got a large number of people admitted with flu, that's going to even sort of shrink the capacity for COVID as well. So could not be more passionate in saying, please go get your flu shot. And now is the perfect time to do it. Everybody needs to get it. It's getting colder. Holidays are coming up. Go get it and do it pronto.
The final question I'll ask you all, and I'll start with Dr. Elliott and kind of go around the horn here on this as we close down. Just the overall community approach again to other activities. And I think you all have talked in your own way about balance in that, but and what some of those ramifications are of especially traveling around more and being around more people. Dr. Elliott, I know that you communicate with parents a lot. I get those emails quite frequently and appreciate them. Your messaging right now to the families of Watauga County Schools students to close out the year, to get through next week. What does that look like at this point in time?
I like your word of balance, David. I mean, we're trying to do all of the preventive measures that Jen and Dr. St. Clair have talked about, along with the testing strategies that have been put into place. So I would say do all of those same things Dr. St. Clair mentioned at the beginning of the session, with distancing, hand washing, wear the masks. Just continue to see more and more people who I know better and who really should be wearing their masks. As parents, I don't take my children or my family into establishments that are not taking the precautions seriously. We don't stay in establishments where we know that people are not wearing masks or where my family might be at risk. We've just made some decisions about how we're going to navigate this as a family and the sacrifices that we need to make. We're monitoring ourselves for symptoms. We're not pushing things aside. We're talking about it every day. We're going and getting tested when we feel like we need to. We're doing all of the things that we've been discussing here and encouraging other people to do it as well. It's really going to take a balanced whole community effort, but at the same time, we as parents must take that individual responsibility. Dr.
St. Clair, I'll let you follow.
Yeah, I mean, I just could not agree more about everything Dr. Elliott just said, but in terms of everybody sort of wanting and hoping for a vaccine to come at some point, the mask wearing is sort of your most preventive, effective thing you can do. So please, please, please wear your mask. It's going to make a huge difference. It's going to keep our community safe. It's going to keep your neighbors safe, your church members safe, your teachers safe. Wear the mask. It's not going to be like this forever, but now is the time to really dial in, wear your mask, wash your hands, keep your distance.
Jen, you're the closer. Bring us home.
I'm just going to lighten it up a little bit and say, you can have a fashion statement with your mask. You can support your favorite team with your mask. Wearing your mask will reduce the spread. And that is one of the most powerful things that we actually have control over. there's so much in all of this that we cannot control. But this is one thing that we actually can do, and we can encourage our loved ones to do. Anytime that we are with people outside of the people that we live with, we should be wearing a mask, really, because I think what happens is we let our guard down around people that we really love but may not live with us, and we care about them. So let's, go back to our Show Your Love campaign and say, show your love to your neighbor, put your mask on and wear it consistently. So there, I lightened it up and then started preaching again.
You can't get too far away from that at this point in time. And speaking of Show Your Love, I think folks will notice that the Show Your Love campaign will be back around in many ways that will be very visible to you here over the next several weeks, as we understand again that this is a very busy time in our community for folks coming in to our community. So as much as we've talked today about keeping our own community healthy, safe, and in the best position possible, it is very important for us to message that to out-of-town guests that are coming here as well, that treat our community like you treat your own. And that's what we're asking at this point in time from folks. And hopefully that's what we'll see from those folks as they come and visit with us and do so in a safe and responsible manner. I want to close by saying thanks to each of you again. The leadership that you're providing in this very difficult time has been a beacon for a number of people to get through this. And we know that one day we'll all gather, hopefully not on a Zoom call to talk about something way more fun. But until then, we certainly appreciate your willingness to share with us today.
Absolutely.
Thank you, David.
Thanks, David.